Hello and welcome to the Leverage Podcast. I am your host, Paul Richard, and we are having a great time already before we opened our broadcast here, just getting to know Dr. Rachel Giordano, and glad to have you on the podcast today. How are you doing, Rachel?
Hey, thanks. I appreciate coming on today. It's doing well.
Awesome. Awesome. Well, give us a little bit of background. Number one, most of the time I'm interviewing people that live in Missouri. You do not live anywhere near Missouri. Where are you located?
Yeah, no, I live in sunny Seattle.
Sunny Seattle. Okay. And it looks like it might at least be partially sunny there. Of course, you're a little bit earlier in the morning at this point. And so tell us a little bit about your background, your schooling. I'd love to hear more about that.
Yeah, sure. So, well, I am a naturopathic doctor, and I graduated in 2012 at Bastyr University, and that's what brought me here to Washington State. Um, and before that, actually, I had my undergraduate in advertising marketing. So I do have experience working in New York City as a an account executive doing fashion design. So I know it's definitely a different career path for sure. But I always knew that I wanted to help people, and I didn't necessarily think that I was helping people in the best way I could, looking well and looking good in, fashion. So I have friends and family that are chiropractors, and so I've always been in the natural health space, and with acupuncture and chiropractic and natural health. And my mother always shopped in natural food grocery stores. So I was, I found out about the naturopathic medical program, and it just clicked, and I said, you know what? That's it. That's what I want to do. And so that was 13 years ago when I got my license as a naturopath, but it was longer than that when I started school here in Bastyr. So it's been a good
Oh,
journey.
very good. Very good. Yes, I went to the University of Nebraska and I crammed a 4-year program into 5.5 years. So I understand how that works, and that was not for lack of effort. It was just a very busy lifestyle, as probably yours was as well. Well,
A
that explains
degree
a
in
lot.
degreeology. I have a degree in degreeology. That's what some
There
people
you go.
say.
Yes, yes, an eternal student, as they called some of them there,
Sure.
and well, one of the things that really uniquely that I see unique to you is you do have a very great presence in the social media space, and that explains a lot. I didn't know that about you. We've known each other for a couple of years now through
Yeah.
Sphere Rocket Virtual Assistants, white label program. Although now I see that is a perfect fit for you because you do a lot of great advertising spots on social media, especially. At least that's what I see, mostly on Facebook that I see. Tell us a little bit about how did you come to focus on women's hormone issues and that type of thing? Is that an area of study in college specifically, or did you kind of get into that as you left school?
Yeah, so, in order for me to have paid for school, I had to do something. And so, I was working a lot in the restaurant business. And when I started the naturopathic program, I was actually bartending. And it was too much on on my hormones because I was bartending at night, making money. And then I would have to get up in the morning and, do a full day of study. And so at that time, my partner, chiropractor, they were opening up a practice in downtown Seattle, and they wanted to bring on a weight loss program. And so they had asked me, hey, this would be a great opportunity for you to kind of get out of the restaurant business and start to help people. And we need somebody to take on this program. And so I said, absolutely, why not? And so I started to see, clients, while I was in school for 4 or 5 years. And although this weight loss program was, amazing and it helped a lot of people, I started to realize, like, after looking at documentation or their intake forms, like, there was a lot more going on there, right? And so, I was looking at the medications, although I wasn't really, you know, I wasn't sure what they were, but, you started to see this commonality of like health history, signs and symptoms, medications. And so when I became licensed, I continued that weight loss program, but I was thinking, okay, there's more to it. And what I was seeing, it was a hormonal thing. People had thyroid issues or imbalances, or, women were going through perimenopause or menopause, and it just clicked like, okay, this program's great for people, but there were some people, it wasn't, it wasn't the fix, right? There were some underlying issues that really needed to be addressed. And I thought, you know what? That's what I want to do. I want to start to help people explore their hormonal health. And so that way, when they're on, weight loss programs like this, then they're going to get the best results, and they're going to sustain those results, right? I mean, how many times, are people on weight loss programs, and guess what happens? They go back to gaining the weight back because there's no support when it comes to hormone optimization, diet, and lifestyle. It's just, a program that people follow for a period of time. So that's how I kind of got into it, or that's how I did get into it. And then after that, I mean, I'm constantly, going to, hormone conferences to learn about the latest and greatest, and, the research around the benefits of hormones and hormone optimization. So that's kind of how I got into it.
Very good. And so you went to work with was it a business partner at that point, or were you just an employee beforehand?
Yeah, it was my actual partner, like actual
Oh,
husband
okay.
partner. Yeah, and him and another business partner, they opened up a chiropractic practice. So I was an employer at that point.
I
And then
got it.
when I
Okay.
became licensed, I opened up my own spot. Yeah.
Okay. And then what year was that then?
Well, 2012 is when I graduated, and so it was right around that time where I got my license, which was, probably about 6 months after I graduated in 2012 in September. So, yeah.
Okay. And so just kind of a 30,000 foot view, how have you seen differences between, so that's, roughly 13, 14 years ago. What have you seen occur during that time period? I mean, obviously Ozempic and some of these other drugs that have come out, GLP-1s, things are new on the scene, relatively new on the scene, right? But what have you seen over those years as you've been in this business and working with women? What have been some changes that have occurred?
Just with social media, and, there's more and more women that are, becoming aware of how important it is when it comes to hormone optimization, and even, bioidentical replacement. So there are more and more women that are actually coming to me asking me whether or not, there may be a hormone issue because they've heard about, signs and, symptoms and concerns of perimenopause. Women weren't coming to me when I was in practice asking about that. I was actually finding it and then educating them on that. Now it's more like, I hear that perimenopause could be the cause of, how I'm feeling and why I'm feeling this way. Can you help me explore that? So there's more proactivity, I guess. Women are more proactive about like looking into this, which is great. Because I've never sold anybody on anything, but it's easier for women to already understand like this is a pretty big thing. It's all over social media. It's, it's more well known. And now with everything in regards to, that the FDA and the WH, WHI, and kind of going back and saying, wait a minute, hormone replacement therapy actually has, benefits, health benefits. It's been a great thing for sure since
Interesting.
I started
Interesting.
seeing patients. Yeah.
Take me back to when you were in school and a little bit. What I've heard is in the allopathic world. So if you're going for your standard MD, you get very little nutritional training, etc. And how is it different in the naturopathic schooling than MD schooling. Can you kind of compare those two a little bit?
Yeah, so that's a very common question that I get is what is a naturopath? How does that, you know, how is that different than my general practitioner? And so the easiest thing that I can do, the easiest way I can explain it to patients is, naturopathic medicine or functional medicine. I mean, it's really in my eyes, you know, pretty much the same as we're looking at root cause. We're looking at root causes, whereas allopathic medicine, it's more of a symptoms disease based model, right? And so I explain it. I say if Joe walks in here with high blood pressure, I'm helping him look at the causes of why he has the high blood pressure, because then that's going to allow me to help create an individualized plan for that particular person, versus let's take high blood pressure symptom disease and match it with some sort of a medication. And when it comes to naturopathic school, we had all of the training that a medical doctor has. I'm considered a general primary care physician in the state of Washington. We have a big scope here. So anything that a patient would do with a general practitioner, I could provide, but it's more about root cause, looking at the causes. And then foundationally, it's, lifestyle and diet first and foremost. I mean, that is the biggest thing that we could help patients focus on, because honestly, as much as I love, herbs and hormone replacement, if we can't help, our patients really understand the importance of diet and lifestyle, then we're not doing ourselves or them, a service when it comes to that. We're missing the big picture. So to answer your question is the naturopathic medical program, there's 5 accredited schools in the United States, is that if you compare the program, all of the medical classes we've taken, but we just add the herbs, the nutritional part of it there. And there's many hours of nutrition and herbal medicine and, all of the good things, all of the reasons why I started naturopathic school.
Awesome. Awesome. And then how is that different than a chiropractic? Now you're dealing with skeletal things primarily with chiropractic, right? And so do you also learn that in your training when you were going through school?
Yeah, we have the ability to manipulate or adjust patients. We had a lot of manipulation. They didn't call them chiropractic classes at Bastyr, but it was it was very much the same. So we had the opportunity to do that, but I don't. I think that there are some really great chiropractors. That's what they're educated in. And so, I usually will refer my patients out to a really great chiropractor locally, usually because I'm seeing patients here in Seattle. But yeah, we have the opportunity to do that. We have a scope. We have a very broad scope, like I had mentioned. We have a bag full of, we call it tricks, everything we have, we have a lot. But I don't, that's not what I do. I send them to the person that's doing it on a day-to-day basis. Kind of like I would want a chiropractor to send me their patients who want to look at the hormones. It's you just want to send people to who's really been trained and up on the latest research about musculoskeletal health.
Absolutely. And I kind of see it, I think of like the Mayo method type idea. If you're familiar with that, I'm sure you are, that you bring in a consortium of folks, because it is the human body. None of us understand it completely. It's got all these factors that we don't even know necessarily are going on. We understand a lot more than we used to. Yet you're absolutely right. Chiropractic requires, I've seen this recently actually, is that chiropractic adjustment, if you don't support it nutritionally, it's going to probably go back to the way it was pretty rapidly, that type of
Yeah.
thing. And so there's so interactive, and so, so often that comes up. And what role does inflammation play in the hormonal issues that you deal with all the time on a day-to-day basis?
Yeah, I mean, we're always talking about, any disease or, any symptom or, I mean, it's all driven by inflammation, right? So, I mean, if you think about it, a musculoskeletal, issue is driven by inflammation. A hormonal imbalance, is driven by inflammation. And, I want to be very clear about when we talk about hormones, it's not just about sex hormones. It's about, your thyroid, health, your metabolic health. So looking at insulin and blood sugar. And so they all have an inflammatory component to it. On top of, a lot of times we don't think about this, but the connection between gut and hormones is super, super connected, right? And so we have to look at, the gut health and how inflamed the gut is. And so by really getting a thorough history, and I'm a big lab person, I like to see data, and looking at markers to help understand, like, okay, what are we looking at in terms of inflammatory markers, inflammatory symptoms, and how do we address it? But inflammation is like the root, it's everything, right? So again, it's a very holistic approach. It's an art of medicine, I think, and so it really depends on the person and kind of what's going on with them. But I'm glad that you brought that up, because inflammation is really, in my mind, the driver of all of the things that we're seeing these days, for sure.
Absolutely. Talk a little bit about gut health and its role as well in hormonal balance and in that world as well.
Yeah, I mean, it's kind of one of those things. What comes first, right? The chicken or the egg, and it's hard to say, but over the years with people and stress and medications and environmental concerns, the gut, the microbiome just becomes not as healthy as it once was, right? And so when that happens, inflammation, and we have this leaky gut kind of picture that starts to happen, and then that could start to cause hormonal imbalances, right? Like even from just the thought process of, if you have a disrupted gut, what does the thyroid look like? How is the thyroid being affected? And then the thyroid then becomes part of all of the other hormonal components. So, for me, especially hormone health, especially when we're looking at, women that want to do hormone replacement therapy, we got to look at the gut. Because what I tell them is that, if we were to look at a bathtub, the water in the bathtub, that's your hormones, right? But if you have a clogged drain, that's your digestive system and your gut health. If we don't start to address the drain first and clear the drain first, then we may be doing a disservice with the hormonal piece of it. Right? So you kind of have to do both at the same time. Gut health is really the first kind of thing that I'm helping people explore and understand first before we even really dive into the hormonal picture, especially when it comes to, bioidentical hormone therapy. Now, with that being said, there's some research that shows that as women's hormones decline throughout perimenopause and menopause, that can actually disrupt the gut barrier even further. Right. So there's kind of that, like, what comes first? We don't know, but it
Yes.
doesn't really matter, does it? I mean, if we're looking at a person as a whole, right, then we're just kind of helping address everything kind of all at once in a sense. So it's not, let's just address the hormones and then we'll address the gut. It's really just kind of doing it all together. And then if you have a good chiropractor who's working on spinal health, that's like a game changer right there. So I'm glad that you had mentioned that, because, naturopathic medicine and chiropractic medicine work so well hand in hand together. It's unbelievable how much a person can feel better when they do both.
Absolutely. It's a whole system, right? It's the
Yeah.
different components of the same system in the human body. And I'll give you an example. The other day, a lady friend of mine here in one of my networking groups, she she's been having some issues with what I would say is the digestive thing. So it's Crohn's, IBS, that kind of thing. And so, you got to look at that holistically and say, I could give you a bunch of nutritional things to take. You're not going to absorb them,
Mm-hmm.
right? And so we're really just kind of wasting that. We've got to, so when you do your assessment, you've got to look holistically, like you're talking about, figure out what comes first, because it is a sequential order. Are you sleeping enough?
Mm-hmm.
Is your, or do your, do your different organs have time to, cleanse during your sleep cycles, all those things. I mean, things that don't come up in a normal MD visit, right?
Yeah,
Okay.
yeah,
You have to
yeah.
talk about those things, right? And so when you do as an assessment, can you just talk about what areas you ask questions in?
Yeah, I mean, my intake form is really, really, it's probably the most thorough intake form ever. I'm sure that my new patients look at it and go, oh, God, I ask them to come in early just because of the fact that it takes some time. But, I mean, even low hanging fruit kinds of things like, water into hydration intake, that's a big one. How is that affecting your overall health, but digestive health? Many people do not drink enough water or not hydrated enough. And so that's a big one. Alcohol, looking at alcohol intake. I mean, that's a big microbiome or gut disruptor. As much as people like their wine and their alcohol, it definitely affects your gut and your liver and all of those systems. So, looking at that, obviously diet, is it a standard American diet? Are you, there's so much now about, people just thinking that intermittent fasting is for them. It's great, but it's not always for everyone, and so a lot of times just not eating and skipping meals actually disrupts, one's health and, promotes inflammation and, hormonal imbalances. So even those that are just what I feel is very basic and what you may think is basic is they're not being even really looked at. Like you had mentioned, you're not going to your GP and they're talking about this. Looking at stress. So you're right. I mean, you can take a supplement or a long list of supplements that help with gut health, but if stress is the main driver or an environmental factor is the main driver, then we're actually not really we're not really we're not focusing on the root cause. We're not working on the root cause. And, a lot of times it's expensive urine for patients, right? They come in with a long list of supplements. Most of them are capsulated. A lot of them are really bad quality. They don't have digestive support. They're not absorbing everything. And so it's like, let's step back and let's talk about, some of the low hanging fruit first and then work on the nutritional thing at that point in time.
That's great. And I don't think I've shared this story with you before yet. You may know I spent 13 years working in the electrical industry as a designer. I did testing, grounding, lightning protection, all these things in different facilities, and utilities would call me in to test and figure out what's going wrong, diagnostics. And one of the things, I worked at several water treatment plants, actually, sewage
Hmm.
treatment plants, I should say. And at the front end, they have a screening process that takes the solids, the bigger solids out. And I remember looking into that vat or whatever it was that was there, and there were thousands of, I don't know, pills in there, like Centrum type pills,
Yeah.
because your body can't digest that. That's a rock. Basically eating a rock. And I don't know if Centrum's the right thing, but they looked like that, whatever the shape of it was. And, and so here it was ending up down here. Nothing got into your system and absorbed. So, yeah, a lot of us are placebo affected by some of these things. And that's why I've seen more of a push for whole food supplementation and that type of thing. Have you seen that happen in your world?
Yeah, absolutely. I mean, food is medicine. And so that usually becomes the first kind of thing that we focus on is, how can we get this in the forms of foods first? Because that's ultimately, where we want to go. And then also just kind of the component of eating, like actually having foods and chewing them and digesting the nutrients from them is going to be much more enjoyable, much more, it's better for someone's spiritual and emotional health just by being able to enjoy foods that nourish your body versus, taking a capsule of whatever that they're taking. So I think whole foods is, like you mentioned, is absolutely number one. It's crucial. It's you can't just take supplements or vitamins and think that you're going to get everything in there. There's so much more about what your body is doing simply by eating whole nutritious foods, right? First. Supplements were
Right.
called supplements to actually supplement what you're not getting in your diet. And now they became, just kind of like this, I'm just going to take them because, coming from marketing, a undergrad in marketing, it's easy for people to buy supplements because of the marketing. It's like, okay, this is shown to, oh wow, look at this bottle. This looks like it's going to give me more energy. Great. The question is if you're fatigued or you have low energy, why? It's probably not a, Centrum deficiency. Although
Right. Right.
Centrum's like the worst out there. Sorry, Centrum, but all the dyes and everything in there, it's like, whew.
Sure. And there's always some new fad thing that's out, it seems like, in the nutritional world. So, now what's huge is seems like it's collagen peptides or something like that, right? So everybody, just give me 1,000
Yeah.
collagen peptides and I'm gonna be great, my skin's gonna be great and everything. And then you find out later, well, a little bit's okay, but you don't need to be taking these or whatever. It's just always something that's out, and then people are buying it, at Costco and Sam's in big vats of it or something,
Yeah.
and they think that's the one thing. But what you're talking about is more. It's a balanced approach. It's holistic approach going on, and a lot of the tests. I have had several people hanging around with this pharmaceutical doctor lately, talking about his new book, Your Plate is Your Fate. And he's into the macro, talking about the macros, right? And
Hmm.
nutrients. And the primary thing he, brings to me a lot of times is talking about the fact that insulin resistance, when you're testing that, you're not even really testing that. If you go to a standard allopathic practitioner, you're looking at glucose levels, which really doesn't tell you what the insulin level is. You're not measuring the insulin level, and so you're completely blind to what's happening in the body at that point. I don't know. Have you seen that, a lot of that?
Yeah, absolutely. Insulin is that's always in my panel. That's it, it has to be. I mean, that's part of what your blood sugar that's your blood sugar health. And like you had mentioned, it's not just about fasting glucose, it's about capturing all that data, that hemoglobin A1C, that fasting glucose. But what's even better than that is I get people on a 15-day continuous glucose monitor because now you're capturing data points throughout the day, and that's going to give us better information in regards to how high and how low one's blood sugar is going through, and that's ultimately going to help, I think, better improve not just high and low blood sugar but insulin resistance, right? Insulin dysfunction. And so yeah, I mean, that's a comprehensive workup right there, right? Is to capture all of that, the fasting insulin, the hemoglobin A1C, the glucose. But then why not put a patient on a 15-day glucose continuous monitor to see what's going on? Because you know what? They're more likely to make lifestyle and dietary changes that way when they have more information, right? Versus just
Right.
saying, here's your blood markers based on one snapshot of a, of a time in day, and then kind of extrapolate that, and then just, and then make recommendations around that.
That's yeah, I love that. I love that. That's so true. And Man, there's so many things to go into and talk about. Yet before we close, I love this. Thanks for taking time out to do this.
Yeah, of course.
Let's talk about the business side of
Sure.
things a little bit. So, you and I have met through Sphere Rocket Virtual Assistants. We're both white label business is with them. And what, as you've developed your business and brought virtual assistants into your business, talk a little bit about how that came about for you, when you started doing that, and bring us up to date as to how you're operating your business differently in the use of virtual assistants.
Yeah, sure. When I started with virtual assistants, it was when I had a naturopathic and chiropractic practice with my partner at that time, and we were actually camping with a friend who's a interventional orthopedist, and Jenna Avola was doing the office managerial part of his clinic. And, anytime we would go camping, we would talk about business, right? Like, oh, we have to let that employee go, or overhead's too high, or, there was always something there. And so we were just about to get rid of our front desk employee again. And Dr. Otonio and Jenna had said, hey, why don't you consider bringing on a virtual assistant like we just recently did? Because it's been a game changer. And we thought, you know what do we have to lose? I mean, we're going to have to hire somebody anyway. So we sat down for like a day and a half and we just wrote down like, okay, what are the things that this particular person that's in office right now is doing that we can delegate to a virtual assistant? Let's start with that first. And what we realized is that there was a lot of things. And so with the help of Sphere Rocket, we decided we were going to start with an an executive assistant first. And then we started with that. It was great. Rena, who is still with us today, it's almost been 2 years. She's my girl. And it was a game changer because it was like, wow, oh my God, like all of the things that we can delegate. And not only that, but we were starting to realize like how many things as a chiropractor and a naturopath that we were doing that we really should be delegating. And so I started to realize that if I'm going to start helping patients improve their hormones, then I have to do the same. And how I do that is by helping other doctors bring on virtual assistants so they can have healthy hormones, but also be able to be the best providers they can to their patients. And so now we have, I have 4 virtual assistants. Social media manager and email marketing manager and account. I mean, it's been such a game changer for both the business growing, right? Reducing overhead, delegating as much as possible. So for my business, yes. For my practice and being the best naturopathic doctor I can be, game changer. And now helping other clinics do the same, it's been amazing. So it's just been a blessing, and it's been a real blessing to meet, everybody at this Sphere Rocket team, and, meeting you, Paul, it's been almost a year, maybe even over a year. I don't know, but it's been awesome. It's been an awesome journey so far.
So give me the overall structure then. So obviously, are you the only naturopathic doctor in your practice right now?
I am. Yeah. Yeah, I am,
Okay.
because I am 100% solely focused on hormonal health and helping women kind of achieve, and optimize hormones. I do a lot of bioidentical hormone replacement, and a lot of what I do is a procedural base because I do pellets in the form of hormones. So, and the reason I can do this, Paul, and see these patients and only be me as the solo doctor is because I'm getting better at delegating things that I don't need to be doing that someone else can do and probably do it better. So that way I can be interacting with patients, and that's all I want to do right now is to give my patients, the time and the energy put forth, because that's what they're there for. And that's what I was trained to do, is to help patients. So I'm a one-woman show these days when it comes to being the only physician right now, currently.
That's awesome. So you have 4 VAs, right?
4 VAs, yeah. Yeah. I'm
In
ready
what
to bring on
areas, can you
another.
break it down? What's that?
I said I'm ready to bring on another, and it's an actually more of a personal assistant, because with the flight travel and going through the emails and all of that stuff. I mean, it's like you get good at delegating, and then it's like it because you can get very creative with using a virtual assistant for sure.
Absolutely. Can you give us a little delineation between the four VAs, what their responsibility areas are, so we can kind of understand the structure of your practice?
Yeah, sure. So Rena is my executive assistant, and she basically does all of my administrative stuff. So, scheduling patients, trying to get patients back on the schedule if we don't see them on the schedule, collecting at the office visit, ordering labs for me. I mean, it's very hard for me to even tell you all of what she does because she does pretty much everything. So she's my girl. And then we have JD, who is my social media manager. So, he is constantly, creating content, holding me accountable because I have to get videos out to him, and posting on my social media platforms. So that's been really, really great. And then I realized that I needed, I have a lot of people that I want to reach, and I have a very big, database full of patients and clients over the years, and I wasn't maximizing that. So I brought in CJ, and he is creating all of these drip campaigns for emails. And which has been great because right now it's, I have two businesses, right? I'm a doctor in one hat, and then I'm also a virtual assistant consultant for healthcare clinics another. So it's, that's a lot of social posts and a lot of newsletters that need to go out. So between CJ and JD, it's been great. And then we have Chris, who is he's our sales guy. He's our, he calls when I'm going out and I'm talking to different doctors, and I'm, if I'm out in networking groups and we're talking about hormones, I'm making mental notes of who I need to reach out to and connect with. And then, so Chris is the one that's calling and getting people scheduled for me, and, making sure that I'm following up, appropriately. So that's been great. But like I had mentioned, now I'm like, okay, I feel like I need somebody else to help me manage my personal stuff, but we'll see. I'm not there yet. But it's amazing because you can give somebody such a great job, right? I mean, these virtual assistants are hard work, and they, you can really provide a great uh, work experience for them, and pay them well. And so I don't know. We'll see. We'll see about the next one soon.
I love that. And once you get in the habit of delegating, it's really fun, right, in a way, right? And we had a conversation before we jumped on to the podcast, and I had a revelation after having a VA for a little over 4 years. Yeah, 4 years.
Oh.
And I finally realized that, I needed to have better meeting structure with them each week, and to set those KPIs out there and our big rocks and the things that we learned at our client intensive, the first one that we did together a couple of months ago. And this shell is pretty hard. It takes a while for it to get
Yeah.
understand things, right? My wife will tell you that. But I have to bump into a few walls before I get it. And now he is, in particular, my manager he's opening up all kinds of things. I mean, he is going out there getting AI tools and saying, hey, look at this, Paul, we did this, we got this, and suddenly I've just unlocked a human being to be all that they can be. It's just amazing. So, and I know you said you do that as well in your practice. Give us a little bit of an idea. And before I ask this question and we wrap up, I was wondering, would you be willing to at least consider coming on with your full staff sometime? And we do I would love to interact a little bit, if they would feel comfortable with it, to just talk about how this thing's structured and everything, and how, from their perspective. I think that would be a lot of fun. Think about it. Maybe we could
Yeah,
do
no,
something
I
like
mean,
that.
I would love it because like I mentioned, that's what I'm trying to help other business, especially healthcare clinic owners, understand is that, if you have the right support and you have somebody like us to be able to help you, understand how to utilize virtual assistants. I mean, that could be a very big game changer for, for a clinic owner or owners. And so, yeah, I would love to, because, like you had mentioned, when you realize what works when it comes to a process, or you're going to implement AI because AI is here to stay, you have to have somebody to help you do that, And so a virtual assistant, that's where they come in, and they can help build SOAP notes, and they can help you understand AI. So that way, we can focus on the things that we are passionate about that we can only do, and they can help us do the rest. So, yeah, the SOAP notes, all of those things, that's a good thing to start, right? Is if you don't have a plan or a structure, then have a VA help you structure that and document it. I mean, we all have
Exactly.
systems we have in here, but if we don't have them somewhere like set, then it's very hard for a business owner to grow, especially a medical office I've seen in the past, and especially just through experience.
I love that. Yeah. I always go by the phrase, imperfect action beats perfect inaction every time, right?
Absolutely.
So you have to get in motion. You have to move forward and get it done. And I mentioned to you earlier, again, it's like I'm ready, fire, aim. So, and there's a story that was told in one of my trainings when I was with Keller Williams, is they asked the question, what percentage of the time was the Apollo 11 on course? Do you know what the answer is?
I was going to say a very high percentage, but I don't know.
This is a stump the panel, right?
Oh.
3% of the time it
Ah,
was on course. Constantly they were adjusting, just like you think about that. And any, if you were off by 1/10 of 100% when you started off, you're going to miss the moon, right? Because by the
yeah.
time you
Well,
get 300,000 miles. But anyway, so it's very interesting. So yeah, constant adjustment is so important. Give us your contact information. What's the best way if someone wants to contact you, whether it's for treatment or something, or just inquiry? What's the best way to reach you?
well, I think that maybe going on to my Instagram handle would be great. It's funny is that I do not know it actually offhand, because my VA is the one that usually manages that. But also my website, which I can provide to you, or maybe we can make it part of this here somewhere post. But in that website, you can either direct yourself to naturopathic hormonal services or VA consulting if you're a medical clinic and you want some more support. So I think it's www.drreachnd.com, I think is the website. I should know that already, but again, when
You
you have
know,
VAs managing all of this, you forget. You forget. You just go talk to my VA, and they'll help you out.
yeah, I mean, I don't know my wife's phone number. It's just what we do, is like hit Jessica and boom, and it calls her, And
Oh my
so
God, yeah.
we're in that world now. So I love that. I love that. Well, Dr. Rachel Giordano, has been fantastic having you on the podcast today. Thanks again for your time, and I look forward to having you back soon.
Thanks so much, Paul. I appreciate it. Have a good day.
You too.